Hello, future doctors. How are you all? Welcome back to MedSteps ECG series. So far, we have learned day one ECG basics, and day two P wave, and day three PR interval, and day four QRS complex. So today we are going to learn one of the most important and life-saving parts of ECG interpretation. So the topic will be like the ST segment. Whenever a patient comes to the emergency department with chest pain, doctors immediately look at the ST segment. So why? Because ST segment changes can be the first sign of a heart attack. So let's understand it step by step. So today, what is ST segment? If you're seeing here, the ST segment is the portion of ECG between end of QRS complex and beginning of T waves. So this is the main spot. Okay, end of QRS complex. Along with that, you can see beginning of T waves. So in simple words, the ST segment time between ventricular depolarization and ventricular depolarization. So for easy identification, we can see QRS complex, we can see ST segment and T waves. It's always remember this sequence. Okay, if you are not remembering this sequence, you will do mistake. So that's why we have to check. We have to always remember this sequence like QRS complex, end of the QRS complex, and ST segment, and starting beginning of T waves. So this is the ST segment. So what does the ST segment represents? For example, the ST segment represents early ventricular repolarization phase, and at this stage we can see the ventricles are completely depolarized, and the ventricular muscle is contracting and pumping blood. Okay, so in simple language, you can see we have imagine a water pump. So for example, you can see here this is QRS complex. The QRS complex turns on ST segment. Okay, then the ST segment, um, when it's turned on the ST segment, you can ST segment is motor is actively pumping water. Okay, then after we can see that is T wave, that is motor begins running to resting state. That means this is like process. First of all, QRS complex means we are turning on the motor. Then after we can see ST segment means the motor is actively pumping water. Next we can see T wave means the motor returns to the resting state. So this is the things. So normally the ST segment um, normally the ST segment is flat. Okay, this ST segment will be like flat, but here what happened, it lies on the baseline. This is called isoelectric ST segment. Okay, if it lies on the baseline, we have to suspect the patient that ECG showing like isoelectric ST segment. So in exam point of view, the normal ST segment will be in flat on baseline, and we can see isoelectric ST segment. Okay, so these are the things. Why is the ST segment is important? Because this ST segment, the ST segment is the most important ECG marker for diagnosing myocardial ischemia, myocardial injury, and acute myocardial infarction. So we have to know, mostly you have to know as a student. Students often confuse these terms because let's in simple way we will discuss about this differentiation. So first of all, we have total ischemia, injury, and infection. Ischemia means what? Ischemia means reduce the heart muscle receives less oxygen, so the cells are become stressed but not dead. Okay. So next we can see that is injury. Injury means the blood supply is severely reduced and the heart muscle is actively uh, damaged. Next we can see that is infection. In infection, you can see the complete loss of blood supply and heart muscles will die, and then we call that is myocardial infarction or heart attack. So in easily for understanding that, we have one memory trick, that is, first patient will get mostly ischemia, then after injury, then after infection. So what happens during ischemia? Here we can see a coronary artery. This is a blood vessel. The blood vessel will become narrow because of some cholesterol, because of plaque formation, because of atherosclerosis. So then after, the blood flow will reduce in heart. So the heart muscle receives less oxygen to the heart muscle. Then the electrical activity will changes. Okay, then the ECG will show some changes in ST segment. Okay, so common causes we can see, like as we discussed before, atherosclerosis, coronary artery spasm, coronary artery disease, and thrombosis. So these are the main causes. Next, you can see that is ST segment. So ST segment elevation. So in this ST segment elevation, one of the most important ECG findings we can see, when the ST segment rises above the baseline, then it's called ST elevation. So why this ST elevation occurs? It occurs usually due to acute myocardial injury. Okay, and most commonly you can see ST elevation will comes in MI. So myocardial infarction, like in acute and in STEMI we can see. Okay, the clinical importance will be like the ST elevation will be like emergency case, and possibly it's like acute heart failure. Sorry, it's possibly acute heart attack. So in exam point of view, if any patient coming with chest pain and ST elevation, we have to treat as STEMI until it's proven otherwise. The patient can get many complications. So next we can see ST segment depression. In ST segment depression, when the ST segment falls below the baseline, it's called ST depression. Okay, so what does it suggest? Most commonly myocardial ischemia. Okay, most commonly myocardial ischemia, and this that means the heart muscle is not is receiving inadequate oxygen. Okay, so what are the conditions it can cause? ST segmental depression means stable angina, unstable angina, NSTEMI, and coronary artery disease. Next, you can see that is we have one exam trick to for ST depression. If it's ST depression means we have to suspect ischemia. If it's ST elevation means we have to suspect patient have acute injury and myocardial infarction. So in ST elevation, you can see acute injury and STEMI. In ST depression, you can see ischemia and non-STEMI. And T wave inversion also we have to suspect ischemia. Okay. So next, you can see that is coronary arteries and ECG leads. So we have some leads. Based on that leads, we can find out where the patient have problem. So coronary arteries and ECG leads, like it's a different ST changes. It help locate the affected coronary artery. So first of all, you can see here that is inferior wall of myocardial infarction. Whenever patient have inferior wall of myocardial infarction, the leads we have to focus on 2-3 AVF. The usually due to right coronary artery. Okay, so the blood vessel, which blood vessel have problem means that is right coronary artery, inferior in wall of myocardial infarction. Second, you can see that is anterior wall myocardial infarction. That means leads will be like V1 to V4. Whenever it's coming to V1 to V4, it's always we have to suspect patient have LAD, left anterior descending artery, also known as Widow's artery. Okay, next we can see that is lateral wall myocardial infection. Lateral wall myocardial infection, that leads will be like you can see the 1 AVL and V5 and V6. That means lateral. Lateral will be like you can the usually due to left circumflex artery. Okay, that means LCX. So in clinical correlation, the patients presents with severe crushing chest pain, sweating, nausea, and the ECG shows ST elevation in 2-3 AVF. Then we have to suspect patient have inferior wall STEMI. Okay, so these are the things. Next, we can see the other causes. Other causes of ST elevation. You can see other causes of ST elevation will be like. Next, we can see other causes of ST elevation. Like not every ST elevation is a heart attack. Other causes include like pericarditis, LD repolarization, and ventricular aneurysm, and left bundle branch block. So always we have to correlate ECG findings with symptoms like history and some biochemistry lab tests like troponin levels we have to check and clinical examination. Okay, next systemic ST segment analysis. How we have to do? Whenever we are seeing ECG, we have to ask ourselves: is the ST segment is elevated or not? Is it depressed? Which leads are involved? Does the patient have any chest pain? Are reciprocal changes present or not? If you are if you are doing currently cardiology department, you have to know the normal ST segment will be like flat and isoelectric, and we can see ST elevation will be like STEMI and acute myocardial infection. STEMI means acute myocardial infection, and ST depression means myocardial ischemia. And inferior MI will be like right coronary artery and inferior wall of STEMI. And anterior MI means it's like left anterior descending artery. That means anterior portion of the chest. Okay, that's septum and anterior. Next, we can see that is lateral MI. In lateral MI, we have to say we can say like 1 AVL, V5, and V6 means left circumflex artery. Okay, so in rapid revision, I will ask some questions. You can comment in. You can comment me in. Uh, you can give answer in comment section. So, what is the ST segment? What are the we already discussed this everything. So, if you know, you can comment. A normal ST segment, ST elevation suggests, ST depression suggests, inferior MI leads, and anterior MI leads. For example, um, in clinical case, for example, think like if at a 58 years old man presents with the crushing chest pain and ECG shows ST elevation in V1, V2, V3 and V4. So which artery is most likely involved? You can do comment this answer. I will give reply. So in at last, I will give some summary. ST segment is period between ventricular depolarization and repolarization. ST elevation means it's like stemming acute injury. Next, we can see ST depression means ischemia. So today, in the end of this section, today we learn the ST segment and the basic concepts of ischemia, injury, and infection. So in upcoming videos, in day 6, we will discuss the T wave, its normal appearance, significance, and how it changes in ischemia, hyperkalemia, and other important conditions. Okay, so if you have any doubt, anything, you can message me in in comment, or you can message me in Telegram or Instagram. Okay, so I'm your Dr. Anand, final year medical student. I'm signing off.